now it's time to have an uplifting conversation. We've moved all the way from Cheponi. We are back in the studios of Channel One TV right here on Breakfast Daily, so you're welcome if you just joined us. We are going to be speaking to a gentleman joining us in the studio. His name is Dr. Delasi Kwame Beko, who is the founder of 12 and 12. Now, he's going to be telling us all about what they've been doing with regards to healthcare or supporting healthcare, giving back to society, volunteerism, and all it has to do with supporting people in the rural area. Doc,
yeah.
Good morning and welcome.
Good morning. Thank you very much.
Well, good to see you in the studio.
Yeah, same here.
Right. Tell us, what is 12 and 12 all about?
Okay, so when I meet people, they ask me all the time, why 12 and 12?
Yeah.
Yeah, so within a year, we have 12 months. So
All right.
yeah, so the idea is that every month we pick a region and then we visit what we call CHIPS compounds. That's community-based health planning and services, or health centers. We establish rapport, we find out what some of their challenges are with respect to health. So we've been visiting, so we've been to all the 16 regions, actually. So even though it's 12 in a year,
You've done 16.
so no, so you see, we've done 16.
16.
So we've done 12,
12 months.
and then we've done the spillover, right? And then we go all over again. So so every month we are constantly traveling. So we've been to every region. We pick a specific CHIPS compound or health center, and we assist with some medical supplies. And we are very passionate about maternal and child health.
Maternal and child health.
Yes.
Now, I'm just curious, what inspired this whole thought about giving back to society?
Oh, right from med school. I mean, I was in KNUST. I was part of a group called Heal the Children. We used to raise funds to get medications for some of their kids in the pediatric wards. And right after school, I joined a foundation, Little Feet, that's based in Bolga. Little Feet, yes. So I used to join them on an annual health outreach. And then I felt that, okay, I'm always going up north. Why don't I come down south? Yeah. And then I just had a thought, how would it feel if I could travel all the way, like all around Ghana, just to see different tribes, just to see like the situations on the ground. And it's been quite interesting what some of the revelations have been.
Right. So you just said it's been quite interesting and you've traveled around.
Yeah.
So what are some of the revelations that you have seen? What are some of the problems that you have noticed that we have that you want to fix or you are trying to fix?
Okay, so I want, one of the things I'll say is that, you see, health is something we should all be stakeholders of. You see, the people we're helping, if they don't appreciate that, okay, we need to have a say in how healthy we should be, we wouldn't make much difference, right? We also realize that the health workers have serious challenges, and these are people that need incentives to be able to continue working. So first, I'll say getting access to some of these CHIPS compounds, the roads, terrible, yes.
So roads?
Roads, terrible. So I'm thinking, how is it even possible, for example, a pregnant woman who is bleeding, okay, how does she get access to a bigger facility when there's an emergency, you know? So, right, the transport, let me talk about medication. Quite a number of them getting medication on a regular basis.
So we have the problem of road access and we have a problem of medical access too.
Exactly. I'll even use, let's not even look at road. There was one district, Angloga district, a CHIPS compound called Trekome, the Volta region. We interviewed some of the mothers. So apparently there was a mother who said she needed to connect to the town via canoe.
Okay.
So she connects via canoe. She has a baby at her back, and then she has a little child, and then they walk an hour.
Wow.
Just to get antenatal care.
Via canoe with two children?
Yes, and then they get off.
And you still have to walk
an hour, yes.
Wow. That's a serious situation right there.
Very serious. Access to the facility, issues with medications, issues with the health workers try to give as much education, but then, you know, we have cultural stereotypes. Yes, and you see, people don't realize this, but when poverty is a problem, the health is not really a priority. You see, these are some of the things we saw. And so, like, we figured we have to champion education, health education. We have to engage the health workers too. Now, look at this. Health workers have access to phones, right? So they see that my colleagues are traveling. So nurses, midwives.
Yes.
My colleagues are traveling. I see on TikTok, I see on IG. They're living their lives in Canada, UK, US. But I'm in a district for several years.
Yeah.
Nothing's happening.
Everyone has forgotten about us. We don't have good accommodation. Is terrible. If you see the washroom facility. So when I was in the Savannah, a place called Sapa Chips Compound, one of the health workers was actually sleeping in an improvised space in the Chips Compound. So right next door, there's just a bed for a patient. So imagine sleeping just in the same space as patients.
Yeah, so but all this that you've mentioned are actually very serious problems and not something that you can handle alone. Have you ever thought of, reaching out to other institutions, probably the health ministry, even the government as a whole, to say, okay, look, these are what I have noticed. Probably nobody's noticing. You understand?
Yes, I get that. Some of these problems have long persisted. And when you interact with these health workers, they tell you, we have, on a countless number of times, made these things known, and we've given up. You see, so the people have given up. I always believe that sometimes you start with the simplest things, and then you build towards, right? And when you engage the people and help them understand that this is what we want to do. So I'll give an example. We sent a few equipment, blood pressure monitoring devices, etc. This will give us some data that, okay, these are the number of people that have hypertension.
Have high BP, yeah.
Or if we check with the glucometers, the blood sugar, then we are saying that, okay, this is the incidence of diabetes in this community.
Right.
Then when we get data, that's another thing. You see, when we get very useful data and we're appealing to other NGOs that have an interest.
They actually help, yeah.
Yes,
because data is sort of like, it goes hand in hand
exactly.
with,
exactly.
I want this from you, I need your help.
Yes,
right.
This is what we are seeing, and this is what we think can solve the problem.
So these are some of the places that you went to?
Yeah. So this is actually in Gambaga. This is the alleged witch camp.
Yes.
Yeah.
That's where we'll be going to this weekend.
Right.
Yes,
and what are you going to do there?
So we're going to have a health screening, a clothing drive, and then we're also going to give them some refreshments. Right. So you see, these are elderly women, with some of their children that have been accused from different communities. So some of them are struggling with malnutrition. Some of them are struggling with skin disease, malaria, typhoid, because sanitation is a big problem. Yes. So we're going there to do some screening, typhoid, malaria, hepatitis B. We're also going to look at the mental health aspect of. We all have a favorite granny, right? Yeah. So imagine they're ostracized. Some of them are suffering from depression. Some of them are dealing with issues relating to menopause. So we're going there to show some love. Yes.
Doc, so I was just wondering, how do you get funding to do all of these? And these communities that you select, what informs the selection process? How do you say that, oh, I want to go to maybe Anglogan or Gambaga, as you have rightly mentioned? How do you do that?
So initially, when I started, it was just a thought that let's do this. So I had a few friends that bought into the vision, right? Coincidentally, we had one of the people from the States. She's with a group called A Mother's Intuition.
Right.
That's into maternal and child health. And then women empowerment too, because we figured that is also very important, right? So from time to time, we get funding from, I started with friends, and then eventually certain institutions decided to come on board, like A Mother's Intuition. So I'll give an example. Even when we didn't have the fiscal cash, we had people sourcing for funding for various projects. One of the projects we had recently, and one that we are going to do this weekend as well, we're going to Tamale first. There's a place in Tamale called Moshi Zongo Chips Compound. Yeah. Earlier on, when we interacted with them, they said they didn't have a very good way of checking the baby's heartbeat when the pregnant women came to the antenatal. Yes. So we were able to secure what we call a fetal Doppler.
Right.
You see, yeah. So even without necessarily having the cash, we are still getting items that are quite expensive that help us to achieve certain or perform certain projects, right? And then help with things like reducing maternal mortality, infant mortality. Yes. We're still looking out for corporate institutions that will support us to,
Most definitely.
yes, do more for these people.
Of
Yes.
course. So in that case, if people want to reach out to you to support you or even volunteer to be a part of your team, how can we do that?
Oh yes, there are various outlets through social media that I can connect people to.
Yeah.
Right.
So
Can
can you
you
Can you
share?
give us out the handles or
The handles-
contact details, if any?
Contact, yes, I can give one of
Sure.
the contact details. That's 053
Yeah.
879 5542.
Okay.
Yes.
And on social media?
Social media for now, it's IG, because we are still young and we are putting.
Yeah, it's fine.
Yeah, so it's Delaso 1811.
Right.
Yes.
Okay.
Doc, thank you so much for speaking with us.
All right,
It's been an
thank you.
insightful conversation, and I hope that as you are giving back to society and helping maternal mortality, people are able to reach out to you so that you also do more for us, because we need it. Thank you
Yes,
so much.
and thank you too for your
congratulations
time.
to you and the whole team.
All right, thank you so much.
All right. Thank you so much.